I just want to give you a little bit about the context with which I am coming on board today. This is particularly not my file. It was a file that a colleague of mine, Don Shepard, who went away for a year, was working on. But I am happy to be part of this project. I have been part of it since the last webinar and since the fall. But I'm also really equally happy that some of the project reference group and people who helped bring this project to fruition are also online today, like Tanya Morrison and Deepti. Both were part of this initial project in its initial stages. So I'm confident that if I miss out on anything or forget anything, they will become handy resources for us today. So I'm going to give you briefly, because I really think our other two speakers are going to really share some interesting presentations with us today, but I just wanted to highlight the project within the context of our work here at the Center for Chronic Disease Prevention in the Public Health Agency of Canada. We are, in my particular unit, in a unit of knowledge mobilization within the Center for Chronic Disease. And what that means is our mandate is actually to facilitate knowledge uptake, evidence use, and the exchange and sharing knowledge. So it's not just the production of knowledge that we kind of limit ourselves to, but also facilitating some sharing. So within that context of the unit's work, Food Security Knowledge Initiative was actually food security was a topic to kind of go with regards to our knowledge initiatives, and we have done other topics as well. So the purpose was, as I said, to develop, apply, and learn about effective KD&E approaches, including the usefulness of the knowledge cycle, which we'll get into in a minute, and enhancing interaction between research, policy, and practice groups. So that was the impetus and the context with which we kind of came on. So particularly to advance action on, so particularly this topic then, to advance action on food security as it relates to chronic disease. We are in the Center for Chronic Disease. And of course, as we know, that working with partners is key to kind of identify, generate, share knowledge that can accelerate effective response to food access challenges that put vulnerable individuals at higher risk. So this was, the food security was part of our knowledge exchange initiatives that we have embarked on. Next slide, please. In this slide, you will see the conceptual framework that was guiding the knowledge initiative, particularly the topic that we're talking about today. But we kind of have this as our guidance framework and theoretical framework that underpin our knowledge exchange mandate. And what is interesting about this is, not only the fact that it's somewhat iterative, even though it's progressional and you kind of start from needs assessment and knowledge creation, but you have to always go back and do an iterative cycle and steps and going back and forth. What is much more relevant for today's discussion is the center part, where we look at context, because really when you are exchanging, when you're sharing learnings from one area to the other, context becomes critical. So within that context, then, you have your researchers, you have your policymakers, and you've got the practitioners. And what I like about this cycle also, it highlights learning from practice, not just from research. So it has this iterative process that links various communities of policymakers, researchers, practitioners, but also really makes context a key. So this is the theoretical underpinning for the project that we've developed here in the Public Health Agency of Canada's Center for Chronic Disease. Next slide, please. So as we went on to, once the topic was decided, a diverse group of people, as the cycle was depicting, had to be brought together. And we had researchers, policy people, and program people, and particularly people from the agency and also external partners but also the First Nations and Inuit Health branch of Health Canada. We all came together as a project reference group. And some of the things that has happened is, you start to scope with this group of people. You scope the area, and we've done scans to scope the initiative to identify the knowledge exchange gaps and the opportunities, and to build on existing work so that you don't want to repeat and create things from scratch, but to build on what is out there, but to also accelerate that progress. So as we got that scoping happening, evaluation and strengthening capacity for evaluation within the context of community food action groups became a key area that needed to come together around. So creating exchange networks, increasing awareness about the links between food insecurity and chronic disease, that whole idea that Deepti was talking about within the health community, and how we can talk about the linkages between lack of food or lack of access to food or food insecurity and chronic disease, and as well as other diseases. So advancing action through participatory community-driven approaches became also really key focus, that you couldn't just kind of do these things and make it a top-down, but make it a participatory approach as well. Thanks, Bill. So a scan was done. Literature review have found that there are community action groups that evaluation was sort of like, whether it's lack of capacity or not even having enough resources to invest in evaluation, we saw a gap in there. That's why we ended up creating the eval guide community food action groups. Community food action groups are diverse initiatives, including examples of food cooperatives, community gardens, policy related to poverty reduction initiatives as well. So there's a large number and a diverse initiatives happening, and that came through when we conducted the scan, that the interventions addressing food insecurity in Canada are listed in this slide. And it was important to have to facilitate and share progress and tell some of the stories and the impacts of those. And you can't really tell a good story, as Deepti was alluding to, without having that evaluative thinking in place, that having that ongoing, not just the snapshots, but the ongoing of learning what is working under what context and what needs to be adjusted and changed. So the gap, as you can all guess, is because community initiatives are busy doing the work and implementing the food actions, so there isn't enough time or there isn't resources for evaluation, and we thought this creating the guide would come in handy in that context. Next slide, please. Developing this guide was quite a lengthy process. It was not really a quick one, but it was also a very rigorous process in the development stages. As I said, there were policy people, program people, community people, part of the project reference group that we put in place. So project working group to advise on the development of a guide to support efforts to evaluate and learn from community food actions. So we had, as you can see from the slide, BC Provincial Health Services Authority, Food Banks Canada, First Nations and Inuit Branch, Health Canada, Public Health Agency. So that, diverse group of people was really a good reference group to guide this. So the literature review found key food security indicators. Any successful or any strong evaluation, I think, or knowing what it is that you're impacting starts with indicators. And they can be both qualitative and quantitative, but good indicators that speak to community action, food action groups. So searching for relevant evaluation resources was also something, and practical tools relevant for food security. So the topic area, it was iterative process, a lot of rewriting and writing, consultations and feedback with local public health units, provincial public health organizations, and researchers within the evaluation and food security area. Next slide, please. One of the key pieces, and I'm glad today this webinar is happening, that we had to take into consideration was making sure that the guide was culturally appropriate and user-friendly. And I'm glad to be listening to the next two speakers today speak about more in-depth about the First Nations and Inuit communities and the issues around evaluation, that you can't just go ahead and impose methodology that you know as an expert and then assume that you're doing good evaluation. It is listening and hearing from community organizations and the contexts within the context that they're working on. So the guide took that into consideration. There was field testing with health authorities. There was test applicability of the evaluation guide in different contexts, and there was feedback from there, determining how user-friendly the guide is, how helpful the examples that are included are going to be. If we can't really have exhaustive list of resources, but is it comprehensive enough? So all those things inform the final changes to the guide itself. Next slide, please. So particularly then when you come to the eval guide itself, and as Bill alluded to, there is a link in the CDPAC website where people can download this guide from. It is, you cannot have something that is going to be for beginners. This is not sort of a primer evaluation 101, if you will, but it is for users and people who are working in programs or policies that have some familiarity with evaluation. The aim of the guide, as I said, is not to provide Eval 101, but to provide people who are involved already in community food action projects with some practical tools and resources and strategies to evaluate their outcomes, because outcome becomes really critical as you do the good work that community food action groups do. So the guide itself, and it's not very long, but it has major components, and in its major components, as you can see from the slide, it addresses food. What is your food community food action trying to achieve? So helps people to think in that process that Deepti has really talked about in terms of that evaluative thinking, that it's not a snapshot, one-time thing, but you need to be thinking about that. And gaining participation and asking evaluation questions on an ongoing basis, gathering evidence on an ongoing basis itself, and then the analysis and the communication and the use of that learnings as well. Next slide, please. So the focus then becomes the focus of evaluation. Next slide, Bill. The focus of the evaluation, if you want to talk about outcomes, you have to then also consider those outcomes within a range. In that range, sometimes the literature talks also about the spheres of influence. So as you think about the impact that your initiative is going to have, you need to think about the spheres of influence of that community action initiative. So thinking about it in that sense, then you would have things like awareness and partnership development can be categorized as a short-term outcomes. As you put your initiative together, you make those connections, you collaborate. Those are early outcomes that you can see. Next to those awareness and partnership building and working together with people, because food insecurity is an issue that impacts the whole of society, working in collaboration with others then will lead to another somewhat midterm outcome around systems change. So systems change, policies would be also another outcome that you can focus on. In terms of really the longer term outcomes, it's a little bit somehow, I think, outside of this scope, because we're talking about societal change once we get to that long-term outcome of reducing vulnerability to chronic disease and other diseases, and reducing food insecurity across communities in this country. So it helps when you're looking at this guide or any other guide of evaluation to think about the impact or the outcomes you want to assess in those ranges, and in tandem with the spheres of influence, and where does you have an influence, where can you contribute directly to the change or influence. So it helps, and the guide sets it up in that way as well. Next slide, please. So features of the guide, as I said, are measurements and analysis companion document as well that we have created, and it uses an audiences for evaluation, sort of like we would like this to be used, and that's why the webinars, that's why the dissemination strategy that we have created when this initiative was done. So it's theoretical. In addition to that knowledge cycle I talked about, it's also enhancing participatory evaluation, because you do want those who are doing the work and those who are benefiting from the community food organizations initiatives to talk to each other, and the evaluations are not sort of superimposed on them. So food security frameworks for evaluations, worksheets, these are some of the resources that are included in the whole guide of resources we put together. Next slide. And this is the slide that spurred this webinar. We have partnered with Chronic Disease Prevention Alliance of Canada, and thanks to Bill and his partners, they have created a website, a microsite that hosts the evaluation guide to enhance the dissemination strategies that we had. So I think we have had a successful number of, the downloads keep increasing, but I think since we started working with Bill and his team last fall, there has been a large number of people downloading, and I'm sure to date things have changed from even the last webinar we have created, but we were at 400 some in January at the last count when we did, so I'm sure there will be more. And I'm hoping that we have whet your appetite enough today, those of you who are listening, that you would be curious enough to download the guide and look at it and see how beneficial it could be for your efforts. And we would welcome any feedback on that as well. So with that, I am going to end there, and hopefully have not taken too much time from the next very interesting two presentations.